Okay, so we'll get to where I left off last time. So I will start sharing my screen. Okay, so we'll go through the finish up nutrition labeling today and start accuracy and precision, which is subject of next week's lab. And we'll see how far we can go. And towards the end of the lecture, 5-10 minutes before the end, I'll go over some lab related information. So just to bring you back all to where we left off, let's ask a few questions. Those that are grade, we didn't get to yet, but it's good to, if when you're studying, you can go back and review some questions. You can go back to these questions to see if you know the material. For now, let's look at the first three questions and type in participation or in the chat box. Is nutrition labeling required for all food? And if no or yes, explain your answer. Okay, let's see. Yeah, no. Okay, give an example. Thank you. So for those of you that said no, for example, fresh produce, eggs, shelled eggs, meat, poultry, cooked food at restaurants. Yeah, I haven't mentioned that last time. No, dairy, you're required to put nutrition labeling for dairy. So meat, no, unless dairy you mean, I don't know what else you mean, dairy, milk, cheese, they all require a nutrition labeling. Smaller packages within a bigger package, that is all correct. Good. So let's see next. What agencies regulate nutrition labeling? So we talked about two last time. Which ones regulate what? Let's see what you remember there. FDA, what does FDA regulate versus FSIS? So FSIS, yes, meat, dairy, no, meat, eggs, and poultry, I believe. And then the FDA regulates everything else. Yep, that is correct. So the last one, what type of analytical methods are required to obtain the values listed on the nutrition label? This is a common question I ask even in quizzes and tests. So when I say what type of analytical method, category, like what is this, what are these methods called under what bigger umbrella category? So we, for nutrition labeling by government regulation, we're required to run methods that are specific. What are these methods? Let's see. No. I'm not asking for a specific certified method. Thank you, Al. So government approved certified methods. In other words, primary methods, official method, they all mean the same. So when I say what type of analytical method, so what category of analytical method, these are official methods of analyses. Primary methods, official methods, reference method, these are all mean the same thing. Yep, very good. All right. So we started looking at the nutrition label, and now all of you have done the lab, obviously. So you have created a nutrition label, and the original nutrition label, which you can still see in the market today, is this one on the left here. But then a newer nutrition label was proposed in 2014. It was approved in 2016. And some manufacturers already, I hear it. Dawn, was there a question or no? Okay. And then, but the compliance date has not yet been in effect. So some say 220 this year, which we haven't seen, and then or 2021. So the compliance date is not yet confirmed. But the differences here between the original one and the new one, you can see here, like calories are really bolded now, and they're huge. And then also serving size is bolded. And then you can see under the carbohydrate section, there is an addition of for the added sugar. So here you have only sugars, but then here you have total sugars and added sugars. And then you have still calcium and iron are still there compared to the original one. They added potassium due to health benefits of potassium with regard to muscles and heart. So this was added. And what was removed was vitamin A and C, and now it's got replaced by vitamin D. And again, this is when in 1999, when the or 1990 with the Nutrition and Labeling Act, there was concerns of deficiency of vitamin A and vitamin C. So that was a reason why it was put on the label. Nowadays, there's no issues with deficiency in vitamin A and C, especially due to supplementation. So you see addition of vitamin C supplementation or addition to juices, for example. So you see that there are supplementation on certain products, and vitamin A, there are supplementation on certain products as well. So there's no issue there. But vitamin D, we have people with deficiency in vitamin D, and this is kind of a concern. So it was brought up to be put on the label. So the difference here is we're removing the vitamin A and C, and we have vitamin D, and they added another mineral, which is potassium. We still have the sodium up there, but then you can also see the potassium down here. If you have any questions, please do let me know.
Hey, Pam, there's a question in the chat.
Okay, let me see. Sometimes when I project, it's really hard to get it. Can you read the question? I can't see. Oh, hold on. I can't get to it. All right. Isn't there a labeling rule going into effect for packages like candy bar that contain 2 servings? They now have to show total amounts if you eat the whole package. I'm not quite sure for candy bars. I really have to look to see what you've seen in the market. Chris, have you seen anything where if you have 2 packages within one big package? I believe that the label is required on the outside. It doesn't have to be the serving. If you have multiple serving, it doesn't matter. But if there are packages within the bigger package, then you don't have to have a nutrition label on the inside package. That's as far as I know. Yeah, unless it is package within the package. Like for ice cream bars, I get a packet, and inside of it there's 2 or 3. I don't see nutrition label on the inside. I see nutrition label on the outside when the packet has 2 or 3 ice cream, 2 or 3 serving, but I don't see it on the inside package. Yeah, if you find an example, that would be good. That would be better. Yeah, if you have an example or picture, you can bring to the class next time and we can have a discussion there. Okay, these are daily reference values for the different components that we have to consume per day, or recommended or a reference value per day. So if you have for fat, for saturated fatty acid, etc., so you see that there are reference values, and these are all listed in the Code of Federal Regulations. So in terms, and that's actually, this reference value is what is used to determine the percent daily value or daily reference value that you would see on the label. So let's say your reference value for protein is 50 grams. And then per serving you are consuming, or it has 10 grams with a PDCAS of 1. That means all of the protein is bioavailable to you. Then you would go, okay, 10 of 50 grams, that's about 20%. So the 20% you'd see in the label is in reference to the 50 grams daily reference value.
Hey, Pam, I think there was a question that was missed from Kat. She asked what is the unit MCG?
Okay, where is that unit?
I actually just looked it up and it said it's microgram. I was just unfamiliar with that way of expressing it.
Okay, I don't even see where that was. I'm having problem looking at the chat at the same time as projecting.
It was back a couple of slides when you're showing us the nutrition facts label for vitamin D.
Oh, I see. Okay, and then of course for vitamins and minerals, there are reference daily intake, and the percentage daily intake or daily value you would see on the label is coming from these reference values. So if whatever the serving is giving you of vitamin C, for example, they would calculate it by dividing it by the 90 milligrams and multiplying by 100 to get a percentage of how much that serving is providing relative to the reference daily intake. So there are rounding rules when you do your analyses and then you want to use these values to plug into and generate your nutrition label. You have to abide by certain increment rounding rules. So for example, if your product has less than 5 kilocalorie, you can express it as 0. And then if you have calories less than 50 calories, you express to the nearest 5 calories. So if you have 44 calories, you report it as 45 calories. And so on for the rest of them. You would have for each type of nutrient or component on the label, you have different rounding rules. Of course, I don't expect you to memorize any of this. It is for your reference in the future. So how do we determine caloric intake? So our caloric content. So the most common one is basically you get the grams of protein and you multiply by how much for protein, how much for carbohydrate, and how much per fat. So how about you type that in your chat box? Let me see. Okay, good. 4, 4, and 9. Thank you. Yes. So 4 for protein, 4 for a carbohydrate, and 9 for fat. You know what it is for alcohol? 7. Thank you. You will be working on that in one of the labs. I'm not sure you're gonna actually, that lab comes after Thanksgiving, so we will have exercises about total carbohydrates and in alcoholic beverages. And in terms of calculating the calories, carbohydrates include dietary fiber. So sometimes you would want to subtract the dietary fiber because it does not contribute, it's not digested, and does not contribute to calories. So oftentimes you take the total carbohydrate, you subtract dietary fiber, and you multiply by 4. And then you add everything up. So for protein quality, and you did that in the lab where you selected percent daily value for protein. And what does that really mean is that proteins are not as easily digested. Not all protein sources will be digested. So sugars, except for dietary fiber, they're all digested at completion. So you don't have to worry about that. The amount of carbohydrate per serving you take it in reference to the daily reference value, and then you get your percent daily value. Whereas in protein, you have different components that goes into the protein calculation. Proteins are not all digestible the same way, so they're not all biologically available. And sometimes you have deficiency in certain amino acids, so we have to account for that. So therefore, the protein quantity on the label has to be corrected by the protein quality. And we do that using two different tests: protein efficiency ratio for infants less than 1 year of age, and then every other food for children above a year of age and adults. We do the test that called protein digestibility corrected amino acid score. We're going to go into depth in each of these in chapter 24, but both are in vivo assay using rat models to determine the protein quality. So we use that value, and usually it is relative to a reference protein. So basically it is the highest value for PDCAS, for example, is 1. So if you have a protein that doesn't have any limiting amino acid and it's 100% digestible, it gets a PDCAS value of 1. So if a serving has 10 grams of protein, 10 grams are available. However, if a protein has a PDCAS of 8 or 0.8, sorry, and then the serving has 10 grams, then only 8 grams are available. So the 8 grams are what are taken into consideration to calculate percent daily value. So instead of using 10 grams out of 50 times 100, you would use 8 grams out of 50 times 100. So we will discuss how these assays are run later on in chapter 24. So let's try to answer this question. Percent daily value for protein is found on the label of which of these products? Let's see what we get. We have G, H, oh wait, F, sorry, because all right, I see quite a few of H answers, and it is the correct answer. Let me explain why. So products with reduced calories, this has nothing to do with anything. So definitely you don't need to report the daily value of protein if the food product is a reduced calorie. That is, a reduced calorie usually is associated with low sugar or low fat more than anything, but has nothing to do with the percent daily value for protein. If we're making a health claim relating to protein, a rich source of protein or high in protein, or any other claim related to protein based on the protein amount and availability, then yes, we have to put the percent daily value. And oftentimes products meant for athletes for regeneration of muscles and building of muscles, you would see percent daily value. And food products for children under 4, because they're still growing, so they need a specific amount of proteins per day. So that is, and they're growing really fast at a very steep rate. So that's why percent daily value for protein is essential at that point, in that case. So B, C, and D, which makes it, the answer is H. Okay. So there are compliance, and all companies are, they have to comply with regulations. So we have to follow rules for sample collection to do the nutrition labeling. And we'll talk about that in chapter of sample preparation, selection, and preparation. So to the number of replication and how the samples are selected for nutrition labeling is set and by the CFR, and the rules are written there, so they have to follow the rule for sample collection and number of application for the determination of the nutritional components on the nutrition label. Methods of analysis, it's not up to, is there a question there? Let me see. No, it's not up to the company to decide on methods, they have to follow certain specific methods, official methods of analysis.
Excuse me,
And your
Pam.
voice is
I'm sorry, but I think you have an audio problem.
I do? Why? Nothing has changed.
Now it sounds fine, but you were going robot mode.
Yep, now it's corrected itself.
Oh, okay. I'm sorry. I don't know what happened. It must be an internet thing. Yeah, please let me know if you have problems hearing me again. So I was saying that the industry doesn't have a choice. They have to comply with official methods of analysis. So the FDA requires the use of AOAC methods unless it's specified, another method is specified in the Code of Federal Regulation for a specific food. And FSIS, they require USDA Analytical Chemistry Laboratory Guidebook and the methods listed there, or AOAC methods if the method is not listed in the guidebook. So these are the regulations for compliance. Now, another component of compliance is the level of compliance. So basically, by level of compliance, it depends on the nutrient itself. So if we have an added nutrient, let's say we are adding vitamin C to a product that doesn't have vitamin C in it, or vitamin D, we're adding calcium and vitamin D to orange juice, which is very, very common practice right now. So when you're adding a nutrient, your label, whatever you claim on the label, should not be less than 100% of what's actually in there. So at any time point, during the shelf life of that product, if a sample is pulled and they analyze vitamin D or vitamin C, it has to be 100% or higher. Otherwise, you are not in compliance. And that is a big reason why, for example, vitamin C is a vitamin that gets degraded by processing and over storage. So that's why the manufacturer always put a relatively good amount above what they claim on the label to account for any degradation during short storage or shelf life. So just that no matter any time during that period that they put on the container, your vitamin C does not fall under what's claimed there. In terms of naturally occurring nutrients, natural, you didn't add them, they're there. As long as you have above 80% of what you're claiming, that should be okay. And then, however, for components that are critical, like calories, sugar, total fat, saturated fat, cholesterol, and sodium, so they have health implications. So you shouldn't have at any time point during storage or after production anything above 120% of what you claim. Okay, so that is critical. You cannot have over 120% of the total fat you claim, for example, or sugar or saturated fat, etc. So these values you should know. I would want you to know these level of compliance. Content claim. So the claims here basically related to content, not health. So nutrient content claim. So that means free, so calorie free or low or fat free or lean or light, reduced, and then good source of, high source of, more. So all of these are dependent on the amount you have reduced or you have of. So let me give you an example. This is a table you won't find anymore in the newest edition. The edition 5 of your textbook, for some reason, eliminated this table. But I feel it's a very good FYI table, and it really helps, good reference. And some of the questions in your lab report, the upcoming one, nutrition label, you would want to look at these tables. One of the questions actually asks you what nutrient claims you can have. And then this table would be beneficial there. For example, if you want to claim free for calorie, you should have less than 5 calories per serving. Then you can claim 0 calories. or low, if you want to say low in calories, it should have 40 calories or less per reference amount. So whatever is the product, yogurt, regular yogurt or a low-fat yogurt, per serving, you should have 40 calories or less. Then you can say low. And for the reduced, in this case, 25% fewer than the reference value or reference product and the value per serving. And then regulations are applied for total fat, saturated fat, cholesterol, sodium. Of course, I'm not going to ask you to know these, but this is a very good reference table. And another reference table that was not included in the edition 5 of this textbook, it used to be table 3.8, that talks about the rich source of or high in instead of free, low, or reduced. And that 3.8 will help when you answer one of the questions in your lab report. And edition 4 should be accessible to you via the library if you want to go look it up. Or it's also, this information is in the Code of Federal Regulations. Health claims, health claims, there are a lot of health claims that are approved. And there's a table in your current textbook, which is table 3.6. And you can make a claim if your product is high in calcium. You can make the health claim calcium and osteoporosis, low in fat, dietary fat and cancer, sodium and hypertension, fruits and vegetables for their content of phytochemicals and fiber and cancer, and so on. So there are a lot of different claims that the claims are usually approved after a long term of research, where they, over many years, they would monitor impact of certain component in the diet on a particular disease. And then after many years and a lot of research, then a claim is approved for use to be used on the label. Okay, so that is the end of nutrition labeling. I will start the next subject, which is the evaluation of analytical data, where we spend a lot of time talking about precision and accuracy, and next week's lab is focused on precision and accuracy. And throughout the semester, when you're producing data, we always look at precision and accuracy of your data. So this is kind of a good thing to start with and learn and figure out how we look at the data and what it means, so that it will help you in later sections of the labs. And I wanted to say also, gosh, it slipped my mind. Yeah, and then in this particular lab, and I'll talk about it later, you learn how to use certain tools that you will be learning, using for the rest of the semester, like pipetting with mechanical pipette, using a burette, a volumetric pipette, balances, and so on. So it's a really good introductory lab for the rest of the semester. Okay, so let's try to answer this question. If you have a method that is more precise in measuring glucose content than another method, that would be the case if all right, let me see here. So I have a mix of answers, which is always good that we are having a mix of answers here. A lot of the answers say either A or A and C. Let's look at A first. And standard deviation is a measurement we use to determine how close your measurements are to each other. And so it is a measure for precision. So basically, if you have a method that has lower standard deviation, like how much the your value is deviating, how much each rep is deviating from the mean, that tells you there's a lot of variation within your replication, that each of these replicates are really further away from the mean. So if you have lower standard deviation, you have better precision. Mean obtained using A is closer to the true mean. That is a measure of accuracy, not precision. Let me see, are there a question there? No, I think people are still answering. You don't have to keep answering when I start giving you the answer. All right. So when you have a set of analysis to do or an experiment to run, like I said last time, you have to run in replication. So you have to replicate the experiment multiple times. I have a question.
I think that some people are confused about what the question was, or the answer to the last question was.
Just the answer. So lower standard deviation of the higher. And the other one was closer to the mean. That's accuracy and precision. Okay.
You're in robot mode again.
I don't know what's happening in the internet. Am I still in robot mode? Yes?
Yes.
I don't know what to do. Maybe if I open my door, will it feel better? Okay. All right, not to be easy. No, there's no wrong. This is so bad. Is everybody hearing a robot mode?
You're better now.
Okay. Yeah, I'm sorry, I can't control the internet situation. Okay. I can't plug into the Ethernet because the Ethernet is linked to my docking station. And I don't have Ethernet in this laptop. And if I put on my docking station, I won't have my video. So I'm sorry, I cannot do that. Okay. I repeat the correct answer again. It is A, because precision has to deal with standard of deviation, and then closer to the mean, that has to do with accuracy. So your only correct answer is A, lower standard deviation. All right. So how do we evaluate our replicates? So when we're running several replicates, the first thing we do usually is obtain the mean, obtain the average. And another one is basically looking at the median, which is the middle point between your set of data. But often you are going to be utilizing the mean to assess the central tendency. That's the first thing we do. Next, we look at accuracy and precision. So we calculate percent relative error, and we calculate standard deviation and percent coefficient variation. I will talk about that. And this determines the error of the analysis, and specifically the experimental error. Sometimes you have systematic error that causes differences in your measurement that would take you away from your accurate value, and sometimes your method is not precise. You have a lot of variation that will eventually lead to an erroneous result. Another thing we look at is how specific is your assay. Are we able to determine specifically total glucose, or are we looking at total carbohydrate? And so what component we are specifically looking for? And then the other thing is sensitivity and detection limit. Detection limit, it can be also threshold. So that means what's the lowest concentration we can detect by that specific method. Now, sensitivity is what's the lowest change that we can detect between two values. So, or two different samples. What's the lowest amount of change that can be detected in your method? And that is sensitivity. So you'll notice that in many labs and in many analyses that you do, whether here in the lab or somewhere else, you would correlate your data and try to have a prediction. So you sometimes, not sometimes, often you have your independent variable and you have the dependent variable. Oftentimes your independent variable is a concentration, and then your dependent variable is an absorption or area under the curve of a chromatogram. And then you relate the data. In food and analytical methods in food, often the relation is linear. So you will be doing a lot of linear regression by plotting standard curves or constructing standard curves using known concentrations, and then using absorption of or area under the curve to get your linear line. And from there, you can get your correlation coefficient and coefficient of determination. So correlation coefficient is how well your data fits a straight line. So the highest correlation coefficient is 1, basically. And the correlation coefficient of determination is your R squared. So how good is your prediction equation? So your equation, how good it is, and how far how much is due to error? How much of that prediction is due to error? And then you report your results, and we're going to spend some time on that in the lab and next Monday when I finish the lecture on significant figures. So sometimes when you multiply numbers and add numbers, you have multiple decimal points, 10 decimal points. We don't want to report all that. We report the significant figures, or the figures that we are most confident about based on the tools and the instrument we've used. And we'll give you many examples later on. There's also rejecting data. Sometimes you do multiple replication and there's this data point that looks really off and skews all of your results. So there is a statistical way to reject a replication when it's really off. So we'll also talk about that and later on, and it's called Q-test that we can do, and sometimes you will be doing that in the lab for some of your data. So quickly here, I'll do this before going to the next. So I want you to make the calculations on a piece of paper next to you, and then give a value, and you get a point for doing that. So just to practice, because you'll be doing a lot of these calculations in the lab, and also, well, oftentimes you're going to use your Excel sheet to get these values, but it's good refresher and practice. So you have measured your moisture content 5 times. So that means you have 5 replications. So what would be the mean and what would be the median? And you can calculate that and start typing it in your in the chat box. Okay, good. And what about your median? All right, I see median is your midpoint. So whatever is the midpoint is your median, yes. And then your mean is the 82.56. That is correct. All right, good. So yeah, it's simple. You just add them, divide them by 5, you get your mean, and if you have 4 significant figures, you keep it in 4 significant figures, and again, I will explain that later on. So that's good. All the answers are still coming in. That's really good. So one last thing here before I switch to what we're doing in the lab. So which of these figures is just a refresher? You've all done this in high school, but we'll be talking a lot about precision and accuracy throughout the semester. So which of these methods or which of these figures have good precision? Let me see what, I'll take few answers. So A and B, yes, good, enough, stop. A and B, good. And then which ones have bad precision? C and D, good, stop. That's good, that's good. And then which one has good accuracy? Yes, it's your B. Only B? B and D, thank you, Abby, it's B and D. Although D has bad precision, but your values are all hovering around the center here. So your average will be close to the true value. So D is not precise yet accurate. And A, for example, is precise but not accurate. So that you have very precise measurement, but that you don't have accuracy. This could be a very simple reason as, for example, your balance that you're using is not calibrated, or your mechanical pipette is not calibrated. That could be this very simple reason. Or you prepare the reagent wrong, but everything else you're doing is precise. So that could be a reason there. We'll talk more about that in lab and as you run different experiments. All right, so I will stop here for in terms of lecture and go to what we're doing in the lab. So as far as I know, and I confirmed with our department head, we're going in person next week. I have not heard anything else from the university or college. So we will have in-person labs next week, unless something happens over the weekend and we hear something and let you know. So our labs will resume under specific COVID restrictions. If you have not watched the video for COVID safety, I urge all of you to do that before coming to the lab. So I think Laura has put the video somewhere. Laura, are you here? Can you tell them where you put it?
I'm in the same room as Laura. So if you go to Canvas and you go under Media Gallery and you hit accept for the software, for what is it called? It's called Kaltura. You just hit accept, and then your videos will be under the My Media tab. Media Gallery. Or Media Gallery, I'm sorry.
So here I'm seeing my media.
Go up a little bit. Yep, Media Gallery.
There, Media Gallery. So if you click here, I don't see any, oh, I have to authorize.
Mm-hmm.
Okay, so after it gets authorized, you will see the video there.
Yes.
We're also gonna post another video that myself, Cindy, and Rachel put together for you. And this video is also essential that you watch before coming to the lab. We will be really strict about that because we are caring about your safety. So we're reducing the time you're spending in the lab. But because we're reducing the time we're spending in the lab, we have all of these videos prepared for you to watch prior to the lab. We expect you to come in and know what you need to do and get started. So in order to do that, you do have to watch the videos. I will send a very clear, yes, the video will be in the same place. I was saying that I will send you a very clear instruction email like I do every Friday where to find what. Please read the email carefully. You'll find all the information that you need. And then you will be taking notes in your lab notebook. And that's the way we're going to track if you've watched the video or not. We also have ability to track if you opened the video and if you watched all of the video as well. So please do that. We're going to trust that you will. We will not have to always check if you watched the video or not, but we want you to be prepared for the lab for your sake, for your partner's sake in the lab, and for your TA's sake in the lab in terms of safety and running the lab appropriately. So I cannot stress it enough. Please, please read the COVID, not read, watch the COVID video and also the instruction video. What we're going to do in the lab is really familiarize you with using analytical balances, mechanical pipettes, volumetric glasswares, burettes, so that you'll be using all of those in different labs in the entire semester. And we're going to determine accuracy and precision of your measurement, which will also carry with you for the rest of the semester. Please review chapter 4 in your textbook and read lab chapter 6 in your lab manual. So we will be needing your lab manual. So either bring it with you to the lab, or if you have it electronically, it will be on your laptop. We ask that you bring your laptops with you because you will be entering the data directly in an Excel sheet that I will be sending you. And I will Rachel and I will, in the video, would go through that Excel sheet with you as well. So the video is very important. We'll be checking the lab notebooks when you come in. So make sure you have them ready and handy. A pre-lab quiz is already in place for you under assignment, right, Laura? I believe Laura has it under assignment.
It won't be open until 3, but yes.
It will be open at 3 p.m. today for submission by 9 a.m. or 9 a.m. Monday or 9 a.m. Wednesday. And we do have extra laptops in the teaching lab if anyone needs. I believe we have up to 3 that you can work on and then email yourself your data. Okay, another thing I want you, we will be meeting in ABLMS 135. If you are able, please come at least 5 minutes early because there are, safety precautions to get you ready to work in the lab as the video describes. So if you come 5 minutes early, everything will be done smoothly and transition smoothly in the lab. One thing I want to show you also is a document that I did post under week 2 on Canvas. We will be in person next week. So there are safety guidelines that we have to abide by. So make sure to read this document, but definitely monitor your temperature before coming in. Inform your instructor, send me an email. If you have any symptoms related to COVID, stay home and arrange to be tested as soon as possible. Inform your instructor immediately if you're aware that you were in contact with someone with COVID. We really need to make sure everybody's safe. Do not come in and arrange to be tested as soon as possible. So I'm sure you know this, but I just need to make sure that I restate that. We will be meeting in FSCN 15. I will be teaching there, but if any of you feel that you don't want to come into the classroom, you will have to come to lab. Labs have to be done in person. For the lecture, I will continue with the Zoom recording and live, but I will be physically in room 15. So those of you that want to be there, we chose room 15 because we can have you spaced out safely in the room, but those of you that don't want to come in will monitor participation and monitor attendance via Zoom online. The same lecture link that you have. If you want to come to the room, to the 15, make sure you washed your hands are sanitized, you're wearing a mask at all time, you maintain distance at all time, and no eating or drinking in the class. Lab in person, these are all described in the video. It's similar what the video tells you, but the video is more explicit. So please watch that video. Okay, and this document is on Canvas for you. Under modules, why did I get an error for the video? I'll have to figure that out, but you'll find this document, COVID safety guidelines, here under week 2. And again, you'll get an email from me with all the details that you need for next week. Thank you all, and I'll see you next week, one way or the other. Have a great weekend.
Thank you.
Yep, you're welcome.